Hi, I'm Twyla Braze. I am co-founder and president of Citizens Council for Health Freedom, and we started this organization about 27 years ago to stop what was taking place across the nation, which is the movement towards taking away the freedom of patients and doctors to work together. Differently than most Americans think, we do not have health insurance today in America. What we have are health plans. And health plans officially are actually prepaid health care, which is very much like socialized medicine because you pay all of this money up front and then you simply hope that the health plan will pay you when you actually need care. If it were a true insurance company, the insurance company would say in the contract that when the doctor says this care is what you need, then we will pay for it. And that's just a two-party agreement. But today we don't have that. And so what we really have is a health plan making the decisions that may or may not work for the patient and may or may not be the ones that the doctor even feels is ethical. They can decide that the care that you need is not medically necessary or experimental or too expensive, or you're not the right type of person to get that care according to their protocols. And that's all the corporate and third-party control of what's happening in the exam room and at the bedside. Sometimes when people hear about catastrophic coverage and they think about paying for most of their own care, except if they have a catastrophe, they think this is impossible. It will be impossible to afford. But that's not true. The reality is we have no idea how low the prices could go if we got the insurance companies out and we had a cash economy in healthcare.
Our service as physicians is best on a one-to-one relationship because for each level of administration that you add, all the insurance people and prior authorization people and legal people and your state government and the federal government and the federal government agencies, the costs have gone up exponentially. You should be able to spend your money your way, and it shouldn't have to filter through your employer, the insurance industry, the state government, the federal government, because believe me, they will all take a slice of your pie.
In the wedge, which is across the nation, we have cash-based clinics, doctors, pharmacies, and specialists. And by cash-based, I mean they're direct pay. You can pay with cash, check, or charge. But what they don't take is insurance, and they don't take government payment, and they are not under government control. It's just between you and the doctor and the decisions that you will make together.
The idea is to drive a wedge between government and insurance and reunite doctors and patients. Medicine, it's best done in a competitive free market like everything else.
Added to this, the seniors in this country need to be able to have catastrophic coverage for themselves. They should not be beholden to a government plan that could take away their life, could ration their care away, could tell their doctors how to practice and how not to, or could completely run out of money and an entire rationing scheme is set in place and they have nowhere to go.
We write our congressman about lots of our other freedoms, but the freedom around your health, to me, is one of the most important, especially as you're facing old age. I'm approaching retirement with apprehension, mainly because I don't want to be in socialized medicine. And that's what Medicare is. My father-in-law, he was on Medicare. It was a nightmare. His hands were tied. Things he wanted to do, therapies he wanted, it wasn't allowed. We just saw that he didn't have medical freedom. When my wife found this organization, it was like, hey, we found our people, like-minded people that are pushing back, and I wanted to join.
To help this system grow, it's really important that people, one, know it exists. Two, go find a doctor in the wedge if you can find one near you. And three, tell your doctor that you want him or her to be independent so that you can pay them an affordable cash price for their care and they can be free of all the corporate constraints that the government and the corporations require of them.
With Twyla Braze at CCHF, we have done a lot together in order to move toward the best possible model where you are in control of your money, your health, your personal data, your genetics, all of your privileged information. No one in this world knows it, shows it, lives it, and fights for it more than Twyla Braze. So I would recommend that you stick with the wedge and help support CCHF in all the ways that you possibly can.
Me and my wife are so happy to have found CCHF because we thought we were the only ones who wanted that type of freedom. And we found a group of people who are wanting the same thing, and we're excited to be joining you.
The healthcare system is meant to take care of the patient. And when you have outsiders who have their own reasons for participating in the healthcare system, you really take the patient out from being the point. The wedge is a way to go back to being there for the patient, to following their ethics, following their morals, following what the patient needs. It's a way to go back to the mission of medicine.
This is your life.
This is what I've been looking for.